Hi everybody, my name is Lilith Sarkisian and I have made a video on the menstrual cycle that I would like to share with you. They're PowerPoint slides and a little video. Share screen. Here we go. All right, so the menstrual cycle is a hormonal process a woman's body goes through each month to prepare for a possible pregnancy. Before I get into the details of the menstrual cycle, I think it's nice to look at a very simple presentation, and we're going to do that. We are going to do that by showing you a quick video.
Menstruation, also called having a period. As girls get older and their bodies change, they get their periods. The uterus is the part inside the body where a baby grows when a woman is pregnant. The inner lining of the uterus supports and nourishes the developing baby. If there is no baby, the lining is shed during her period. During a period, blood and other tissue from the uterus leave the body through the vagina. A period can last from a few days to about a week. You may have heard doctors talk about the menstrual cycle. This is the time from one period to another, usually about 28 days. Day 1 of the menstrual cycle is the first day of a period. The uterus starts to shed its lining. As soon as the period ends, the uterus prepares again to receive a fertilized egg. Eggs are released from a woman's ovaries. Eggs are super tiny, 1/10 the size of a poppy seed. Women have 2 ovaries, one on each side. The fallopian tubes lead from each ovary to the uterus. In the middle of the menstrual cycle, an ovary releases an egg. After ovulation, the egg travels down the fallopian tube. It takes a few days to complete the journey. Meanwhile, the lining of the uterus gradually gets thicker so it can support the development of a fertilized egg. If the egg gets fertilized, it will implant in the uterus and the woman is pregnant. If the egg is not fertilized, the woman is not pregnant and the egg will begin to dissolve. Because the woman is not pregnant, the lining of the uterus is not needed. A woman will have her monthly period and the cycle begins again.
Review of the menstrual cycle. Again, it's the hormonal process a woman's body goes through each month to prepare for a possible pregnancy. This happens in 2 places, the ovaries and the uterus. The ovaries will need to prepare an egg for fertilization, and the uterus will need to prepare for implantation of the egg when it is fertilized. So when the menstrual cycle has 2 parts, one part is the ovarian and one part is the uterine. It is happening in 2 different places. The ovarian cycle has 3 phases, the follicular phase, the ovulatory phase, and the luteal phase. And the uterine cycle has 3 phases also, the proliferative phase, the secretory phase, and the menstrual phase. The names may sound confusing, but if you break it down, what that phase is doing is described in the name of it. The ovarian cycle is what is happening in the ovaries. The follicles are in the ovaries and they are producing the first phase where the follicles are growing so that ovulation can happen. You see the words follicle, ovulatory phase. The uterine cycle is in the uterus, and that is where the lining is thickening and hence proliferating and secreting and getting ready for implantation. But if that doesn't happen, then menstruation happens. I want to point out here that when we're learning about the menstrual cycle, please keep in mind that when we say the menstrual cycle, we are referring, that's the umbrella term for everything that's going on both in the uterus and in the ovaries. If we want to differentiate it, for example, on a test, or differentiate the two areas, then we will indicate that we're talking about the ovarian cycle or the uterine cycle. But if we just say the menstrual cycle, we're talking about the whole thing in both places. So, a little overview of how it works. The menstrual cycle is a reflection of the cyclic release of hormones on the hypothalamic pituitary ovarian axis, the HPO axis. Gonadotropin releasing hormone starts things off. It's secreted by the hypothalamus, which stimulates cells in the anterior pituitary to make follicle stimulating hormone and luteinizing hormone. And these two hormones act on the ovaries. Follicle stimulating hormone stimulates follicles so that they can grow and produce estrogen. And the luteinizing hormone promotes ovulation, and progesterone is the key hormone there. This process of which hormones are involved and where they come from and what they act on is important to know, not just now so that you understand the menstrual cycle, but later on when you're trying to figure out why a woman won't get pregnant. Okay, so for example, if a woman has a pituitary tumor, you can see the production of follicle stimulating hormone and luteinizing hormone may be affected, so that there will be nothing to act on the ovaries to stimulate follicles to mature and grow. And now you can see why she may not be able to get pregnant. So now let's look at each phase in detail. So, and lastly, I want to point out that when we are talking about the menstrual cycle, with all the ideal dates, we are assuming that a perfect cycle has 28 days. Okay, but some cycles can be as short as 20 days and as long as 35 days. But when we're referring to all the dates here, we're referring to a 28-day perfect menstrual cycle. Okay, so the ovarian cycle, first we start off with the follicular phase, and this starts from the first day of the menses, which is on day 1, and ends just before ovulation. Okay, this phase has the most variation in length. It is usually somewhere between 10 to 17 days, and it can vary from woman to woman and from cycle to cycle. Remember how I just said that the menstrual cycle is 28 days long? So in a perfect world, you would have 14 days long follicular phase and a 14-day long luteal phase. Okay, adds up to 28. Follicles are little fluid-filled sacs with immature eggs in the middle. Baby girls are born with about 1 million follicles, but many are just absorbed and go away during childhood. Once she gets to puberty, she has about 400,000 left that are eligible to develop into mature eggs. During the follicular phase, specifically the first half, about 10 to 20 follicles are recruited and start growing. And so what happens between days 1 through 5 is as multiple follicles are growing, estrogen levels rise. And then in the mid-follicular phase, competition to become a dominant follicle happens, as you can see down here in this photo. And this moderate levels of estrogen act on the hypothalamus and anterior pituitary to inhibit follicle stimulating hormone and luteinizing hormone secretion in a classic negative feedback loop. As a result of less decreased follicle stimulating hormone production, some of the developing follicles in the ovary will stop growing, regress, and die off. And then around day 7, one follicle becomes the dominant follicle. And you can kind of see that in this graph where your hormone levels are kind of low, but they're going to go rise up in a second. The follicle that has the most follicle stimulating hormone receptors will continue to grow as the other follicles give up and undergo atresia. Day 7 through the end of the follicular phase, this dominant follicle continues to mature and produce high levels of estrogen, which eventually stimulate follicle stimulating hormone and luteinizing hormone in a classic positive feedback loop. And this surge of the follicle stimulating hormone and luteinizing hormone usually happens a day or two before ovulation. And it is responsible for stimulating the rupture of the ovarian follicle and the release of the oocyte. This leads to ovulation inducing luteinizing hormone surge. As you can see, it peaks here, okay? Because follicle stimulating hormone, luteinizing hormone are being positively affected, which brings us to the end of the follicular phase. End of the follicular phase, the follicle bulges on the surface of the ovary, ready to ovulate, as you are kind of seeing here, okay? Well, this is ovulation has happened here. All right, I've highlighted the dominant hormones that are playing a role here in the follicular phase: follicle stimulating hormone, luteinizing hormone, and estrogen. And from the rest of this PowerPoint, the hormones that I want you to focus on in the phase is highlighted in green and yellow. All right, so here's another representation of kind of what I'm talking about. This image does a nice job of recapping. All right, you can see how the hormones made by the anterior pituitary are acting on the follicles to grow, leading to ovulation. And you can see the dominant hormone here is estrogen, which is controlled by the production of follicle stimulating hormone and luteinizing hormone. And then we get to the ovulatory phase. And this phase, there is an LH surge, which was happening, right? And the follicle protrudes, the vesicle ruptures, and the oocyte is extruded. And then there is ovulation. Okay, about 32 to 48 hours after the luteinizing hormone surge starts, and about 10 to 12 hours after the LH peak, the luteinizing hormone peak, is when ovulation has occurred. So this is kind of important to keep in mind when we are thinking about how ovulation predictor kits work. Okay, here again, this is a nice image that does a nice job of walking you through what we have talked about thus far. You can see how the production of the hormone started in the hypothalamus, the anterior pituitary, gonadotropin releasing hormone. You have your FSH and SH, where their levels are low and then they peak, especially that LH peak triggers ovulation, okay? And you can see here how that follicle stimulating hormone is working on the follicle, and your follicle here has ruptured and ovulation has occurred. This is where we are, mid-cycle, exactly halfway through day 14 of ovulation. After ovulation, we're still in the ovarian cycle. This is all still happening in the ovary. We have the luteal phase. And what's happening in the luteal phase is it begins with ovulation and ends when the new cycle starts. And this phase is progesterone dominant, as you can see I've highlighted. What happens here is the luteus phase lasts about 14 days, and generally this does not vary. It's quite reliable in all women. Again, what this means is that in a perfect 28-day cycle, ovulation is in the middle, 14 days before the next menstrual cycle and 14 days after the start of her menstrual cycle. However, for women who have longer cycles, like for example 33 days, what that means is that based on what this means is that 14 days before the first day of her last menstrual period, also known as an LMP, all right, she ovulated. This is a very important concept to understand when it comes to dating a pregnancy. Again, we date a pregnancy based on someone's last menstrual period. Well, that date is 14 days before she got her last menstrual period is when she ovulated. And that's what I'm highlighting here. This is not it is quite reliable on all women. Okay, so everyone, when she gets a period, you know that 14 days before that, she ovulated, right? So after ovulation, the walls of the dominant follicle collapse inward, and this follicle undergoes changes to form the corpus luteum, also known as the yellow body. And you can kind of see here, it's yellow in the photo also. The corpus luteum produces large amounts of progesterone. That's what it does. This progesterone suppresses the growth of new follicles, okay? And progesterone causes an elevation in the basal body temperature. This allows the woman to measure her basal body temperature and know whether she has ovulated. So those ovulation predictor kits, one of the things women are doing is measuring their temperature in the morning before they get up and do anything. And she won't know she's going to ovulate because her temperature will go up after the LH peak, after progesterone starts being secreted. And then that's all that progesterone increases her body temperature. So we'll know that she has ovulated, but we won't know when she's going to ovulate. And remember that beginning part of the follicular phase is the one that varies. We don't know. It might be 10 days. It might be 17 days long. Okay. So if conception doesn't occur, the corpus luteum rapidly regresses 9 to 11 days after ovulation. Declining corpus luteum results in decreased progesterone levels, which leads to withdrawal of hormones, which leads to menstruation. Okay. And then here again, you can see the ovulation has happened and your peak hormones here, what's going on. Okay, so after day 14, progesterone level continues to go up and up and up, and LH and FSH are low again. This is another photo showing you, okay, it does a nice job of recapping what we talked about. And as you can see, estrogen starts low on day 1. It rises when all the follicles are developing and producing estrogen, then rises steeply when the dominant follicle is secreted and produces loads of estrogen. This high level of estrogen stimulates luteinizing hormone and a positive feedback loop. Progesterone is low at the beginning of the cycle, but rises markedly when the corpus luteum is formed after ovulation takes place. If no pregnancy happens, the corpus luteum begins to degenerate, and at around day 25, estrogen and progesterone levels fall, and that's when you get menstruation. And the fall of the estrogen and progesterone allows follicle-stimulating hormone and luteinizing hormone to rise again, which then allows new follicles to be recruited as the new cycle begins. This is an image that does a nice job of showing what is simultaneously going on in the ovaries and the uterine cycle. You can see that the follicular and menstrual and proliferative stage are mirroring each other here, and estrogen levels are low. And then with the luteal phase, progesterone levels are high. And then now we're going to mirror and talk about the uterine cycle, okay? Starts off with the menstrual phase, okay, which is the beginning of the cycle, lasts around day 1 through 5. It is the degeneration of the endometrial lining. When the bleeding ends, the uterine cycle moves to the proliferative phase. And what's happening with the proliferative stage is this is estrogen dominated. This part is going to get the woman pregnant. This phase lasts from about day 5 to 14 days, which is when ovulation is going to happen. It ends with ovulation. Increasing plasma estrogen levels cause this proliferation to occur. Remember, the estrogen was being made by that dominant follicle, right? During this phase, there is proliferation of endometrial glands and stroma. Now we're in the endometrium lining. The endometrium thickens and regenerates. Also, there is emergence of spiral arteries from the basal layer. It is getting ready for implantation. The endocervical gland, stimulated by estrogen, produces thin, clear mucus to lubricate the vagina and to facilitate the sperm to help capture and transport the sperm. This phase is estrogen dominant, and all the changes taking place are to help the woman get pregnant. Okay, the cervical mucus is changing to help facilitate the sperm, and the uterine lining is proliferating to get ready for implantation of that fertilized egg. And then recall what's happening in the ovary right now. Ovulation is occurring, okay, and the corpus luteum is producing progesterone. So this is the secretory phase, is a progestational phase, progesterone dominated. Progesterone acts on estrogen primed endometrium. Now the progesterone dominates. During this time, spiral arteries continue to grow and the uterine glands continue to secrete even more mucus. Okay. The endometrium thickens and secretes glycogen. Remember, I said that was important for the embryo when it was the fertilized egg as it's dividing. And at this point in the cycle, a woman's body acts as though she has conceived at mid-cycle and she needs to protect the new conceptus. Thus, progesterone encourages uterine quiescence. So this is now conceptus traveling and trying to implant. The uterus won't contract. it out. So the uterus is a muscle, and the progesterone acts to calm that muscle and to prevent any contractions from happening. And this is an important thing to remember, because when we get to the part where we talk about preterm labor, one of the medications that we use to stop or prevent preterm labor from happening, labor is when the uterus muscle contracts, is to give a woman progesterone. Okay. Progesterone makes the cervical mucus also very thick and sticky. So assuming the lucky sperm has gotten in and done its job, which helps keep other things like pathogens out of the developing uterus and protects the new conceptus, okay? And so this is a progesterone dominant phase. All the changes taking place are helping a woman stay pregnant, okay? And this ends with, if she is not conceived around day 25, the corpus luteum is degenerating. When the levels of the estrogen, and specifically, especially the progesterone, drop off, the corpus luteum recedes, the endometrium begins to be deprived of all the hormones it has relied on this whole time, which leads us to the menstrual phase. Okay, when progesterone reaches its lowest levels, the spiral arteries constrict, they collapse, leading to decreased blood flow and oxygenation to the endometrium, which results in the functional layer of the endometrium shedding through menstruation. Okay, and just a quick word on embryonic age versus gestational age. When we talk about gestational age, what everyone refers to is the gestational age, how far along a woman is in her pregnancy. Okay, it is calculated for the last menstrual period, but she didn't get pregnant. Now that you understand the menstrual cycle, she didn't get pregnant on her last menstrual period date, right? She got pregnant 2 weeks ago, because remember I said you ovulate 14 days before you get your last menstrual period. So when she goes to the doctor and we're trying to date a pregnancy using Nagel's rule, we ask her what her LMP is. And then to that, we use the Nagel's rule. But her last menstrual period is not the date that she got pregnant, remember, okay? She got pregnant 2 weeks before that when she ovulated, and there was an egg there that got fertilized. When we talk about embryonic age, that's how long the baby's been growing since implantation, okay, and or since fertilization. So implantation happens about 5-6 days after fertilization. So ovulation happens, okay, and that is the embryonic age, when that egg and sperm fertilize. So when we talk about fetal development and the heartbeat and when it can be heard, some books and sources will say 3 weeks, 2 days. Okay? That's the embryonic age. But when we talk about gestational age, it is 2 weeks added to that, all right? She wasn't pregnant yet, okay? It's 2 weeks added to it. And so it's off by 2 weeks. And so really at 5 weeks and 2 days of gestational age is when we can hear that baby's heartbeat, okay? All right, and that is the end of my video on the menstrual cycle. Thank you everybody for listening.